In this patient's particular situation, we will be performing resurfacing using the carbon dioxide laser on the lower eyelids. Now, I would say in most of our patients at this point, we are using a 35% trichloroacetic acid for the lower eyelids. However, this patient has a significant amount of rhytids, and I feel that a deeper resurfacing modality is probably more appropriate. We can be a little more aggressive with the CO2 laser than I am comfortable with a 35% TCA. Additionally, this patient has an excess of lower eyelid skin. Now, we can see the corneal shields are in place, and all the standard safety precautions should be undertaken when using the CO2 laser. This patient does have an excess of lower eyelid skin, and it is not uncommon for us to perform a transconjunctival lower eyelid blepharoplasty, resurfacing procedure, and a pinch at the same time. The pinch offers the advantage over the skin muscle flap of not disrupting the muscular tarsal-fascial sling, and is associated with less vertical shortening of the lower eyelid. However, in this patient's case, she has an extremely lax lower eyelid, as you can see, and I'm a little uncomfortable performing a pinch. So we're going to do the laser resurfacing. We'll do 2 of the 3, and if indeed the patient has some excess skin at 6 to 8 months or maybe 9 months, we can perform a pinch to gather up some of that. But at this point, all we're going to do is resurfacing and the transconjunctival blepharoplasty for fat removal. Okay, so we're going to use the carbon dioxide laser to resurface. Now, this is Sharplin's product. There are several different products out there as far as CO2 laser resurfacing. The most important thing is that the power density is above the threshold for vaporizing tissue, which is 10 joules per centimeter square. The start-safe parameters of each laser are usually listed in the manual, and for this handpiece, the 125 handpiece, using 7 watts. Again, it really doesn't matter how many watts you're using, as long as the power density is above the threshold for vaporizing tissue, which this is. Okay, so we will do our first pass. Lasers on. Okay, you have the vacuum. We will do 1 full pass. This is a focus beam in a spiral pattern, a 0.2 millimeter path. And what you're seeing is the helium neon beam, because that, as we know, the carbon dioxide laser is a colorless or clear laser. So now we're doing the contralateral or left side. We're doing 1 full pass. The most important thing in performing this is to display some type of symmetry. Although clinically it really doesn't make a difference if you're down a 0.5 millimeter more on the right or left side. It will avoid a lot of questioning from the patient as to why you went lower on one side or more lateral. Although clinically it doesn't seem to make a big difference. All you're trying to do is to break up some of the wrinkles. Okay, stand by, please. Now, once you have performed the resurfacing, you need to wipe the char off. Now, there are 2 important things. First of all, you need to get all of the char off the tissue. If you don't, the next pass, rather than vaporizing tissue, will simply, the heat will be absorbed by the tissue and it will coagulate the tissue. The temperature will rise above 55 or 60 degrees Celsius, and you will just cause a full thickness injury. The second thing is, once you've wiped off all the char, it's very important as well to wipe off all the saline or water that's used, because the carbon dioxide laser is absorbed by the water, and you will lose some of the energy that's needed to vaporize tissue. Again, then you're below the threshold for vaporizing and can actually coagulate or cook the tissue. So we've dried that completely now. Now, one thing that's different about the Sharpen product, okay, laser on please, is that this is a focused beam. So we want to stay at the focal length. Okay, Coherence product, as you go further distance, the amount of energy delivered is the same, but it is not with this laser. If you want to try to diffuse the energy over a greater, then you want to angle your beam rather than diffuse it or go out further. By simply going out this far, now you're below the threshold for vaporizing. I like to use what I call a second half pass on the lower lid. You can see this is an angled beam. The tissue that's being hit with the laser is above the threshold for vaporizing, but the spiral goes over a larger area. As we get into the lateral canthal region, again, we hit this a little more perpendicular. Okay, now we're going to finish up our second pass on the left side, and again, we do this in somewhat of a half pass. You can see the beam is still at the same focal length, but it's over a greater distance, so the energy is, the tissue that it hits is actually above the threshold for vaporizing it. As we get laterally, the skin is a little thicker, so we can be a little more aggressive with a full second pass. Sometimes I just want to get very close to the eyelid because when patients see that skin's untreated, it'll save us some questions. In theory, Sharpen's product's actually a better product because you don't have everything that's hit by the laser is treated. In other words, you don't have a Gaussian distribution to the treated area. So theoretically, you don't need a 10% overlap, which is what was initially recommended by Coherent. However, clinically, when you look at these studies, Fitzpatrick did a good study looking clinically at patients who were treated with Sharpen's product and Coherent's product. At 1 year, it didn't seem to make a difference at all. I think the bottom line is if the tissue is treated appropriately, simply breaking up the rhytids, making them less noticeable, is clinically all we're after and gives an acceptable result. As far as our dressings afterwards, we use an occlusive dressing with Aquaphor and Interface for 48 hours. That's changed with a gauze over top to absorb some of the exudate, and then the interface is taken off and the patient is kept on Aquaphor for the remaining 7 to 10 days.